of the major ways to manage high blood pressure, that is hypertension, nutritionally, is through the use of what we call DASH diet. Yes, what is this DASH diet? DASH diet is simply an acronym used for dietary, which means dietary approach to stop hypertension. That is it. DASH means is the acronym for which means dietary approach to stop what? Hypertension. So this DASH diet, what does it work? Dietary approach to stop hypertension, which is DASH diet, works in helping to reduce the rate of complications accompanying doing the management of high blood pressure. Yes, it helps in the management of hypertension nutritionally. And how does this work? This DASH diet is planned based on helping to reduce the amount of fats and the amount of sodium rich foods that a hypertensive patient is likely to take. It it contains a well-planned meals that will help the hypertensive patients in curtailing the amount of foods that are high in fats, that are high in fats that I mean is mostly saturated fats, that are high in animal rich foods, and that are high in sodium. Foods that are high in fats and foods that are high in salt, that's sodium, and one of the risk factors of hypertension is eating excessive amounts of foods that contain higher amounts of sodium, salt, and higher amounts of fats. How can you tell if a food has high amounts of sodium? Yes, you can actually tell using the food label by reading the food labels, and you can also tell by when you make that meal the amount of sodium rich condiments that you use in preparation of that food. So one effective way you can actually use in managing hypertension is through reducing the amount of fats intake, through reducing the amount of sodium rich foods, that's salt, the amount of salt you use in the preparation of your meal. And this can be found in many packaged products. Yes, most processed foods contain a higher amount of salts, and that is the reason why it is very recommendable you read your food label. So this DASH diet is actually planned by helping the individual to cut down the fat intake and the sodium intake, and thereby helping the individual increase the calcium, potassium, and magnesium intake. Yes, this is how this DASH diet is usually planned, and you can get a sample of this DASH diet from the description box down there. Yes, click on the description box and get a sample menu. This will help you. This will actually give you a guide on what to eat, when to eat, and the amount of food you should be able to take. And these foods are likely to have a little bit of amount of sodium in it, depending on your preparation and depending on the way you adhere to this food menu. Also, these foods are known to contain a bit higher amount of calcium, higher amount of potassium, because if you are a hypertensive patient, you should be able to take foods that are rich in calcium and foods that are low in what? Sodium. About the fats intake of hypertensive patients. If you are hypertensive, you are recommended to take plant-rich sources of foods. Yes, more of plant-rich sources of foods. That will provide you with what we call good fats. Yes, your high-density lipoprotein and foods that doesn't have cholesterol. You are likely to see foods that are rich in cholesterol in animal food sources. Yes, so that is why it is recommendable you go for more of plant food sources. That is where you'll be able to get fats, unsaturated fats. Not more, you shouldn't go for saturated fats. You should go for plant food sources. For example, you're likely to see a high amount of cholesterol in your eggs, in your meats, That is where you are likely to see cholesterol. And when you consume foods that contain that are more of animal fats, you are likely to get a higher amount of cholesterol intake. So it is required and recommendable that you go for plants rich sources of fats. Modifying your diet, that is trying to change the amount of food you eat, the type of food you eat, and when you eat it, will go a long way in helping you manage the condition high blood pressure. Thank you very much for watching. Bye.